So I'm Margaret Fire-Robin, and I'm with both Bristol's Promise and Family Promise at Bristol. And we started these meetings virtually in March of 2020 and continue. We also have Bristol Coalition meetings that since January, we've tried to coordinate instead of our meeting. So we still have 2 meetings a month, but one of them is Bristol Coalitions. One is coordinated community response. And that's also, assuming we have a little bit of time to chat today, it's also just picking your brains to think about how's the most efficient and helpful way for us to work together in the coalition work that we do and the networking and sharing, et cetera. So appreciate everything everybody does. So we usually go in an order and cover some things, but I will kind of jump around and y'all can introduce yourselves and give any updates that you might have. Also jump in anytime, definitely through the chat, but also if somebody is given an update and you need a little more information, just interrupt and ask for it. We're a small enough group, I think we can do that. So usually early on our list, Andrea is United Way. So we'll put you on the spot. Also know some of y'all have been doing this from the beginning. Some people may be first time here today. So you can identify yourself as whether you're, an old timer or not, also which organization you work with, et cetera. So Andrea.
I am Andrea Birchfield, and I'm the resource coordinator with United Way of Bristol, Tennessee, Virginia. I am not an old timer. I have been in this position since about the middle of January. And so we are still doing COVID CARES utility assistance. If somebody has been financially impacted by COVID, we can, with those CDBG grants, we're still, I still stay busy with that. And then with the air purifiers, we still have some of those available. And so we assist clients who live in the city of Bristol, Tennessee, and a little bit in Sullivan County. So that has slowed down some. It kind of goes in spurts. So that is what I have to report.
Right. And the CDBG, that is for both Tennessee and Virginia.
Yes, it is.
I'm sure many of the people on here have worked with you on that and know that there's quite a bit of paperwork or whatever that has to show that is directly COVID related.
Yes.
So,
yes.
Which the longer out we go, the harder it is to ascertain that and meet the criteria that's given for that. So thank you very much. So, okay, just skipping around, Ann Sparkman, you're next to Andrea. So on mine, and you're actually next on the list too. So go ahead.
Okay, I think I'm filling in for Doug still, but he takes off on Fridays now. So are we?
We're glad to have you, Ann. Identify what organization you're with.
Okay, I am with ARCH, the Appalachian Regional Coalition on Homelessness, and I am the employment specialist there, working with our clients who come through coordinated entry, helping them find work or better work. And I talked to Ann Cooper. I said, what do you want me to tell people? Because I've actually been working at home with a hurt knee. So I've been out of the loop a little bit. But we did get a AmeriCorps grant refunded, or it's a new grant funded for $345,000. And that will begin 8/1/2022. And let's see, we also are working with several of y'all on a strategic plan to address homelessness, with the goal being that completed in 2023 for a 10-year plan. And many of the community leaders in the 8 counties are working on that as well. So we're just getting started on that. That's going to be a bear. We also received an extension on the ESG CV grant, but we don't know exactly what all that means, if it means any more funding. They have not told us that part, THDA. And there's no word yet that we've heard on the Emergency Solutions Grant for 2022. So we're still waiting on that. And we are hiring an AmeriCorps program coordinator, and that is listed on our website at appalachianhomeless.org. If anybody knows anyone interested, that's a full-time position, and the details are on the website. So that's about it for me.
Thank you. And just on the AmeriCorps, those folks are focused on housing, correctly? Correct.
Right.
And also those are limited to Tennessee, correct?
That is correct.
Yeah. But we are thrilled if y'all aren't aware of taking that lead, and being AmeriCorps is no small feat to become that AmeriCorps funded site. So going through that process is rather intense. So we appreciate the fact that y'all did that and that you're continuing to make that available. So
now the person would not have to live in Tennessee, but the
right.
work would be in Tennessee.
Right. So Tennessee agencies apply with y'all for an AmeriCorps worker. So if anybody
as a host site.
Right. So if anybody's interested in being a host site, they can contact Ann and she can point them in the right direction. So, or Archer or me, and I'll point you in the right direction.
Yeah.
Thank you. So, okay, let's do our cities. I think Ellen and then Christina, or if y'all want to tag team differently, however way you want to do it.
Go ahead, Christina.
Okay. Hey guys, good morning. I'm Christina Blevins, City of Bristol, Tennessee. I'm the Community Development Specialist, and I'm an old timer here. See me with my cane? No, just kidding.
That's not funny. That's where Ann Sparkman has a bad knee.
Oh, sorry, Ann. Sorry, Ann. Trying to make a joke, and you can't ever do it anymore.
No, you can't do that anymore.
Okay, sorry about that. Well, we have our 2022 action plan almost complete for HUD, and our allocations came in last week. So CDBG, we had $223,176, and in the home consortium, $1,238,877, which of course that sounds like a lot of money, but it gets split multiple ways. So it is hard for every community to make their money count. We have
Christina, so what does that compare for both of those accounts to last year? Is it similar?
It's about 1% increase.
Okay.
So you know, it really just depends each year what Congress and the feds decide to give to us. So it's about 1% increase. Wouldn't you say, Ellen?
Nothing yet. I was just agreeing about that 1%.
Okay. Bristol, I hear Ann was talking about the regional strategic plan for homelessness, and Andrea kind of talked that there's a whole bunch of people involved with this too that are doing a Bristol Homeless Coalition. So we attended that meeting on Monday. Also, we have been doing monitoring updates and visits for everybody. We've got a couple COVID funds still out there remaining. And that's really all I have. If anybody has any questions, I'd be happy to answer anything.
Sounds good. Let Ellen go and people can keep asking questions.
Okay, very similar information. The City of Bristol, Virginia got $269,250 in CDBG funds. I have just completed our draft annual action plan, and it is on the website. It will be posted in the library, and it will be available at my office. Our second public hearing is scheduled for Tuesday, June 14th. If anybody has any questions or comments, anything like that on this year's annual action plan, let me know or come to the meeting, whatever you like. We still have some CV money out there. United Way is doing the BVU utilities. And we still have the rental assistance program through, it's actually through the Envision Center. So if anybody knows of anybody that still needs rental assistance due to COVID, and as was said, it's getting harder and harder to make that connection. But anyway, there's still some money available. The other thing I want to mention is the city of Bristol has PPE, a lot of it.
Okay.
So we're still willing, even those on the Tennessee side, as long as you serve some folks on the Virginia side, let us know. We've got gloves, masks, what is it, the cleaning, hand sanitizer, that kind of thing. So please let us know. You're welcome to have whatever you need. We'd like to get it out of some of our stock rooms. So please let me know if there's anything you need.
All right. That's awesome. Family Promise will get in touch for a day services. That'll be fantastic. So.
Can I ask a question? And I guess this might be backing up to Anne, to you. So I had heard that there was going to be maybe it was an unofficial pit count in the summer. Is that still planned to be the case? I know we do it in January every year for the official one.
Ann Sparkman?
Yes, they are. And I want to say it's July 27th. Don't quote me on that. But that was discussed at the Continuum of Care. And I don't have a recent update, but we should be hearing about that soon. We'll let y'all know.
Thank you.
But it's going to be an unofficial count to see what, we don't feel like, the January was a real accurate count.
So that sounds like we need to check with, so Virginia folks, who's your point person for the pit count? Is that People Inc. or is that y'all local?
It'd be People Inc. It'd be Betty Segal.
If you could send that contact to me, Ellen, because it would be awesome if we could parallel that in Bristol, Virginia with.
Yeah, we had gotten together for something the other day and I hadn't heard anything about that, but
yeah.
But why don't I mention it? I'll send her an email and I'll copy you on it. That way you'll have it. Okay?
So we're kind of, it's like we've been fussing about the January pit count and why do they do it then, which part of it, do they really not want to show how many people are homeless? But a part of the rationale is, I believe, is in the metro areas. That's when more people are in shelters, so they can perhaps get a more accurate count by doing that. But yeah, so the concept to do a July one and see how it compares and see if we can make the argument with HUD and the powers that be that we need to have either a second one officially done, or that we need to move that date, or somehow for them to recognize that that the January may not accurately reflect. But it also, we may end up it's similar and we can figure we're okay and don't need to hold to or stop complaining or something. So anyway, Ellen, did you want to add anything? No. Yeah, so I'm excited about that. So, but that does mean organizing, getting volunteers and doing it just like we've done it before. So, and seeing how that is. So, okay. And also just when we talk about the COVID having to be directly related, all of us here know that there are huge impacts from COVID. That the ripple effect and what's going on is absolutely trends that may have been before COVID, but exacerbated. But the problem, just like with everything else, is when you have to document it and show direct, it just makes it a whole lot harder. So anyway, so we know people need help, a lot of help, and we know there's some money available, but sometimes those things don't mesh up. So anyway, okay, how about some more? TJ, do you want to talk about Envision and housing? And
Sure. Hey everybody, this is TJ Bradley with the Bristol Redevelopment and Housing Authority. Here at the Envision Center, we are still taking referrals from the community. For community members, we can serve anybody on the Bristol, Tennessee or Bristol, Virginia side. We do have restrictions when it comes to places outside of the Tri-Cities like Elizabethton or Coburn, just for example. But we can help with various needs. So you can just refer them to the Envision Center either in person, which is here at 144 Birch Street, or you can give them our phone number. I don't have that right offhand, but it is everywhere. And even if you Google it, it should pop up, or it's on our website at brha.com. And then we are also taking applications for housing. I know that's few and far between right now. But you know, you won't get a house if you don't put your name on the waiting list for a house or an apartment. So, and we encourage everybody to come and apply. We do have a waiting list, but to apply, you can come to our office and use the kiosk in our lobby to apply for housing. But that's about it.
Thank you, TJ, very much. Okay, and let's see. Looking to see who else is good to call on. Bree, I know you're driving. Are you able to talk for a second, or you want to pull over?
I have a hands-free device, so it makes it a little easier. I'm Bree. I'm with Healing Hands Health Center. I'm their community health worker. Really, our updates are medical. We are accepting patients. We are accepting patients whether they are working or not, if they're uninsured. We are expanding that area, but we are also expanding dental. There is a waiting list for dental right now, but we are working on opening 4 new ambulatories, as well as we hired a new dentist that will be starting in August. So we are hoping to be able to get those, that waiting list cleared out pretty quick. But we are still putting people on the waiting list. So if you have people desperate and need to be on there, definitely let us know. As far as my job is concerned, I am still accepting community referrals. If you all need a community health worker, I'm primarily working on the Virginia side. There can be exceptions made if need be, but I can help, of course, work on any of those social things that they may need. So just let me know. You can call or email us, either one.
So thank you very much. And also Cindy Rocket sometimes is on, and she's with Crossroads, and some of y'all may have attended their, they did a ribbon cutting. They've got a new building right across from City Hall downtown, faces Scott Street, I think, instead of facing towards Lee Street, City Hall's. Anyway, very nice facility. This is their first time to have their clinic services with brick and mortar, so not just their mobile unit. So they're entering a new phase to be able to offer services there. So we want to congratulate them and thank them for the work that they do. So, okay, let's go to mental health. Casey, if you're able to update us.
Yeah, I can. And I can come off of camera, or come on camera, I guess I should say, for a second. I don't have a ton to update, mostly just kind of some end of year statistics for us. After a pretty great year, we ended up seeing over 31,500 students in schools, which is wonderful, being able to provide our Mental Health 101 program to them. And this is only Tennessee, only on the Tennessee side. But we are, planning and gearing up toward this next year. I know like Bristol, Tennessee City Schools, they've already put some dates on our calendar for the 2022-23 school year, which is really exciting for us. We've got lots of community, I would say events and community events and presentations, trainings. I know with Bree, actually, we've got one coming up here in June. And that's really exciting again for us. We're able to continue our trainings throughout the summer, even, despite everything else going on. But yeah, that's it for the most part. Like I said, I don't have too much to update.
So can you tell us what Mental Health 101 is?
Yeah, I would love to. So Mental Health 101, it's our free, it is free. Everything that we do at the Mental Health Association of East Tennessee is free. We are able to go into schools, usually middle and high schools, but sometimes we are able to go into the occasional elementary school. And we teach this free program called Mental Health 101, where we basically just talk to students about mental health, explain what it is, who has it. We say, surprise, it's everyone. And, you always get the kids who say, oh, what, really? And have that aha moment. It's great. But yep, so we go in, and a lot of what we do is focus on, destigmatizing mental health. We explain just the very I mean, the mere basics of some mental health conditions. We talk about healthy coping skills versus unhealthy coping skills. We do offer suicide prevention as part of that curriculum as well. Most of our programming, it follows along with the state of Tennessee's social, emotional, mental guidelines, all of that fun stuff. So that's the condensed version.
Right. Without giving the class to us. So also you talked about training. So what kind of training do you offer, and can anybody from Tennessee, and maybe if we needed, and I'm going to ask if there's folks here who know what's available, who to contact in Virginia, or maybe who's the best contact in Virginia. But I know some of our agencies overlap, so we can always see if we can invite Virginia people to attend a training that's hosted by a Tennessee agency or whatever. So talk about the training for a second.
Yeah, so as far as trainings goes, we can be pretty flexible with you. A lot of what we do is based on request. So I've given trainings on self-care and how to avoid burnout. I've given trainings, and this is employers, employees, this is community members and groups, this is health councils and coalitions, this is your basic youth serving organization after school program. I mean, all of the above, right?
You can do it. Yeah,
exactly. Right. And that's what we enjoy doing. We want to know what you all need, right? What it is you are seeing, as far as I would say, what are your gaps? As far as mental health care, what do you want to know? What do you not know yet, that you're looking for? So a couple weeks ago, I gave a presentation solely on stigma and the stigma of mental health. How do we fight that? How do we work to combat that stigma? I've also given presentations on just mental health in rural communities. Again, that basic self-care, what are some things that I can be doing that I'm not already doing? Healthy coping skills, a kind of your DSM version of here are all of our mental health conditions that are pretty common in this area, and then tailor that to the county or to the city that we're in. So you name it, and we will we'll do it.
So and do you know what agency who does it in Virginia parallels y'all?
So the parallel to us in Virginia would be Mental Health America of Virginia. However, they are, as far as capacity wise, they do not currently have strong enough capacity to come down to Southwest Virginia as often as they would like to. And so I know the executive director up there, his name is Bruce. He's wonderful. He's constantly trying to find ways to bring services and trainings and such down to this area. But it is a struggle. He's based out of Richmond. So a lot of what they do is kind of focused in that central area. I will say this, while we are the Mental Health Association of East Tennessee, if I were to host a training on the Bristol side and Virginia folks were to show up, I'm not gonna know. So it is perfectly fine. I was gonna say, if we can make that happen, then
Great. Thank you. That's fantastic.
Hey, Casey, this is Brandy with Bristol's Promise. So I think you and I are probably going to become very good friends, because I just I have all these new ideas that I don't have time to think about today, but I have all these new ideas along with my employers that I'm partnered with that may be a great fit. So if you can drop your email, I'll shout out to you.
Yes, I would love to. Awesome. Yep. Sounds great. And I will, this is my warning to everyone. Every meeting I go into, I always tell people now, I am 8 months pregnant, so I will be having a baby at some point soon. If you do not hear from me after July, there's a reason, right? I'm on leave, but keep trying, and I will definitely get back to you at some point. So that's my little warning.
Congratulations.
Yes,
thank you.
Thank you. Yep, I'll put my information in the chat. That way, if anyone else has any questions, or if you're wanting to, partner on anything in the future, just feel free to reach out. We're always open to doing any kind of training and or, fun youth event, anything like that.
Great. Great, and that is a little disadvantage of not being in person, that you have to self-reveal your.
Right, you only see from here up. You don't get to see the big baby belly.
Exactly. Well, we will also look for, when we send you emails that we get back, I'm out of office, but a picture also of a new baby. So that would be
For sure. Thank you.
great thing. So thanks very much. So Brandy, do you want to go ahead and talk about Bristol's Promise Bristol Connect program? Give us a little update.
Sure, absolutely. Hi, everybody. Brandy Peters here with Bristol's Promise. I am the program coordinator for the ACEs and Trauma Informed Care Network, and also responsible for the Bristol Connect program as well. So the Bristol Connect program, for those that you don't know, is a workforce sustainability program. We partner with other agencies and businesses throughout our community, and sometimes outside of our community, to provide wraparound resources to their frontline workers and to teach and educate from the top down, really, about the effect of ACEs and trauma on adults, and why that happened, and kind of how to work with people that are experiencing ACEs and have a history in their past of traumatic events. And currently partnered with 2 large manufacturers here in Bristol. I was with both of them all day yesterday, and we've seen an increase in the use. If you don't know, a standard manufacturing facilities employee assistance program, which is a 800 number that you call and you talk to a person that you never met, you never seen, and you tell them about your problems and they direct you somewhere else, gets about a 1% usage rate. The last time I calculated the usage rates for both of our manufacturers in Bristol, one was at a 12.5% usage rate, and the other was almost a 15% usage rate. So what we're doing is working. So if you know of a business that is looking to really care about their employees and to really support them, please reach out to me. We are excited to announce that we are accepting new partnerships. So if you know of a business that you think would be a good fit, that we can just go love on some people and help them, please reach out and let me know, and I'll drop my information in the chat box as well.
Thank you. Okay, so we have a lot of good health folks here today. So Courtney, do you want to talk for a minute?
Hello, everyone. I'm Courtney Price. I am the Healthy Families Coordinator. We are an evidence-based home visiting program here in Sullivan County. We're kind of new, but we're kind of not. We came when COVID came, so we kind of had to take a wait on this program and do COVID jobs, and now we're back in business. We started this program up and running last July, so if you've not heard about us, then that's probably why. But we see families of all walks of life. Insurance, income is not a qualification to our program. If they need services and we have openings on our caseload, then they get services. We more focus on prenatals, because we like to get moms when they're pregnant and keep them until the child's 3 to 5 years of age. We go over anything from prenatal to postnatal depression screenings to ACEs, and just stay in the home weekly for the first 6 months.
Great. Yep, and we know more and more that home visiting is one of the most effective things. So great to have that. April Wilson, can you talk a little bit, Virginia Department of Health?
Yes, hello, my name is April Wilson, and I'm a community health worker with the Virginia Department of Health, and I'm covering the Mount Rogers Health District. And we are offering Rapid Revive training to organizations throughout the district. If you are interested, you may contact me, and I'll put my email address in the chat. And we are also collecting items for our giving project. All items will be distributed to clients in need, as well as different organizations throughout the district. If your organization has any items they would like to donate for this project, they can reach out to me or drop them off at the local health departments.
Thank you.
April, Real quick, April, is there a cutoff for those donations? Like, is there a deadline you want those in by?
I'm not really sure, but I'm not really sure.
It's just kind of on like a rolling basis.
Yeah.
whatever you can get, right?
Yeah, I think so.
Great,
Yeah.
thanks.
Thank you.
Great, thank you. All right, Frontier Health, G. Hickman. And it's G or G?
Yeah, G, it's G.
G.
Hold on, let me turn on my video. I am the liaison for Frontier Health's Juvenile Justice Reform Division. So I just started the Bristol position in March, and I am looking forward to trying to get into some of the Bristol schools. We do what is called a teen outreach program. It's called TOP. And I've worked in Washington County schools for 3 years. This program is for those youth that are on the borderline of making good choices and deciding how to make good choices. The majority, our main goal in juvenile justice reform is to stop recidivism in the juvenile courts. So we also offer what is called a cannabis youth treatment group for youth that have been caught vaping or marijuana use, often through dab pens, and maybe some alcohol as well. But it is for the ones that are just experimenting. We do a SASE before the youth start the group in order to get a more in-depth feel or assessment of what the youth have been into. So that way we can also, of course, refer to the adventure program or to family or individual therapy if needed. The JJR program also offers the first team, which is our family in-home resilience stabilization team, which is a therapist and a case manager, a licensed therapist and a case manager that goes into the homes, and the families have to have a commitment of 6 months to work this program. This is a multidimensional family therapy plan, and it is extremely successful for the youth that have been frequent flyers in the juvenile court. We also offer a coping with anger group for young people, teenagers, that is offered at the Bristol courthouse on Tuesdays at 3:30 for any youth that's being court ordered to participate in that. And the CYT, or the cannabis youth treatment, is offered on Mondays at 3:30 at the Bristol courthouse. I personally would like to be able to help with some of the vaping issues that is continually coming into the juvenile courts. It's a lot in Bristol. So hopefully when school starts back, now that I'm getting used to Bristol and getting more familiar with things that are happening in Bristol and resources that are available in Bristol, and getting more familiar with our judges, then hopefully I can start working and networking with the schools and the principals and the guidance counselors and seeing if we can't start maybe a commitment, a vape-free commitment with some of the youth, or, you know, just give them some information about the truth. It's not safer. There's just a lot of information that's not been investigated yet. And to kind of inform the children the truth from the theories or the misrepresentations of cannabis and vaping, and how so often these companies advertise to children instead of, and that's just a whole other issue, but that's something that I would really like to get into this fall.
Great. So just observe it, and it sounds like if you don't already know Casey, sounds like it would benefit for the two of y'all to talk.
I think it would be great, and I don't know Casey. Sorry, I'm in a car. Casey, please
We're gonna,
reach out.
yeah, we'll be sending the chat notes, and
Thank you. Thank
and
you.
if you need contact information, we're happy to do that. Also, Sullivan County Anti-Drug Coalition doesn't regularly attend these meetings, but they certainly are. But looking to see who's already on this in the schools. It'd be nice if everybody who's kind of doing some similar work kind of together put together a program and said, mental health 101 is where you start, and then we go here and present.
That would be fabulous. Well, last year in Washington County, some of the schools had asked the JJR liaisons, we're called the liaisons, those of us that are in the courts while the cases are being heard, had asked us to do some of the summer school programs for the vaping information and the cannabis use treatment information. Just basic refusal skills, basic, healthy choices, who is on your side, who is going to help you, just basic information along those lines as to, what was it I heard yesterday? Somebody said your drug dealer is not your best friend or something like that. I can't remember.
Yeah.
So,
great.
And don't pick up anything you see on the floor and put your lips on it. That's just what I want to say.
Okay, so yeah, and again, if anybody needs anybody's email address, we should pretty much 100% sure that we'll have it. So don't hesitate. We might not have everybody's phone, but we've got everybody's email addresses probably. Okay, so Lois, if you want to talk for a minute. Lois Willis.
Hi. Hi there. I think TJ has pretty much updated you with anything. I don't think I have anything to add to that, but I am with Bristol Redevelopment and Housing Authority. I do work at the Envision Center as a resource navigator. So I just kind of take what you all share and try to share it with anyone that comes in. And of course, we've got programs going on here at the Envision Center. So yeah, I think that's it.
Thank you. Amanda Holcomb.
Hi, good morning. Amanda Holcomb with 211 Virginia, which is housed at the Council of Community Services located in Roanoke, but I cover the Southwest Virginia. I don't have too many updates. As you all already probably know, there's just a huge need for housing and utility assistance, those additional safety nets. And that's what we're seeing right now with 211. Our numbers, we're the information referral system for Virginia, and our call volume is comparable right now to it was during the height of COVID. And we know that that's likely because of what's going on in our housing world primarily. And just if you're not already in the database and you're interested in being in our database, you can contact me if you need help with your listing or updates or any type of alerts, which are just updates that are temporary. They might not be permanent to your listing, but they're important for inquirers to know about your operations. Just get in contact with me. I'll put my information in the chat. Thank you.
Amanda, the application, if they're not listed, it's online. Can you get you can get the application online to fill out the information?
You can, if you want to do that, or I can get you in touch with a database person, but online at 211virginia.org. I believe it's in the right-hand corner. It will be like, you can edit your listing to there, or you can sign up for your agency. There will be an inclusion-exclusion policy just to review. If you're a nonprofit, you 100% usually qualify. And then you just start your listing. It's pretty simple, but some of it, especially when you start adding programs, can get a little complicated.
Okay, yeah, that'd be great to provide that. And just, I know I'm not always good at keeping up with those, but just a reminder to everybody that 211 is the universal nationwide number. So people who aren't familiar with an area may use 211 for a phone call or to go to the website. So no matter how many other listings we have, having that 211 as the universal one certainly is something we all need to be participating in, because that very well could be somebody's first stop, and it's easy for people to remember 211 as opposed to remembering some of our other different opportunities for getting resources. So appreciate what y'all do, and also just the history of 211 when they first established it. They great idea, but I don't think they provided money nationally. It was up to each state, so we see a variety in how well it's been operated in the different states depending on how well it was funded. Amanda, you can correct me if I'm saying anything that's not.
That is true. In other states, like in Florida, they sometimes have multiple 211s. It's not just the statewide program. So they might have one like in one county and versus another county too. So it's interesting. It would be nice if they could fund it completely as a nationwide service, but it is very state to state. With Southwest and Tennessee being, side by side, we do have Bristol, Tennessee agencies still listed in our database. And then also, if you're literally on the line and you want one or the other, most have 1-800 numbers because 211 is going to ping off whichever line it is. So if you need to get Virginia and you keep getting Tennessee, then you can call that 1-800 number.
Okay, great. So thank you, and thanks for being here.
Yeah.
So, okay, Dottie, Family Promise of Bristol.
Hi, I'm Dottie Havlick. I am the president of the Board of Family Promise of Bristol. And we are now gearing up. We got all our papers signed and everything to open day services in cooperation and at the building of the Salvation Army on Martin Luther King Jr. Boulevard. And we will be opening in mid-July. We will be announcing those just for a soft opening, and we're getting ready. We've been approved by the United Way for Day of Caring, and so we're going to have new paint, and we're already getting some donations of furniture, and we're planning and getting lined up with all our volunteers and our trainings for our volunteers. And so we are very excited to do that. We are also continuing with our programs for homeless prevention and rapid rehousing. And so we're waiting to hear, as Ann said earlier, on our ESG grants and other things. But we're getting ready to actually do it.
Thank you, Dottie. And I'll just add to that we are winding up our current grant that ended up being $569,000. The bulk of that was to keep people in their homes when the eviction moratorium ended. And so we are finishing with that. The money's coming out, so that by the end of June, that funding will be gone. We also got some extra funding in March that we put toward rapid rehousing. All that will have a zero balance at the end of June. So we are hoping that we will have some funding coming in through ESG. Those dollars are the real dollars that help people put in housing. And usually those government dollars are the ones that have the bigger amount to be able to do it. then nonprofits can do some, but usually not to the extent that those federal grants. But we don't know yet if we will have it. But in the meantime, people still can be referred to our office for the coordinated entry that then figures out, are they eligible for some of these programs? If there's a wait list till we see if we have additional funding, also referral to other agencies and opportunities that might have some funding. So referrals to see whether people qualify are still a good thing to do. So also I will share that, and for our paint and trying to fix up Salvation Army, we're trying to be trauma informed and kind of choose some colors and try to make it be people friendly as we work on doing that. We also have received a Tennessee Department of Health grant that we're getting the particulars to be sure that, you know, when you get notice you received a grant, but they're not going to tell you how much and until they get the contract done, et cetera. But it's looking like hopefully that's going to be funded. And and United Way also is receiving one. And theirs is focused on pandemic and COVID treatment, and I'm not sure what else. So Andrea will be learning more about the United Way's grant, and United Way will be learning about ours. And Courtney, it's health department related, so we're going to be working with health department. It's their COVID grants for looking down the road for what happens with this pandemic, as well as what's coming next, as we know is probably going to happen. So trying to be prepared. Ours is to work together and be sure that as a community agencies, we are ready to respond. And so we will be checking, but we see that as all of us here and others working together. We believe that it has to be Tennessee and Virginia because that's our community. So we can't just do Tennessee side, even though it's a Tennessee grant. So anticipate trying to formalize some of the work that we've actually been doing, working together. And the grant has a staff person that will be devoted to that. So we're excited to have that opportunity. So thank you, Courtney. And so we're very excited about that. We're also excited, you know, sometimes you write grants and you kind of have an idea of what you want to do and then find out that the granting agency has a little bit other ideas. So we're hoping that our ideas mesh well and we'll have good understanding and be able to move forward. So anyway, excited about that and what that can bring to our community. And also, I think not tons of people applied for it because they gave it a 10-day turnaround. So it was very short. Andrea, do you want to add anything?
No, I really don't have anything to add. That's really more of a Lisa.
Right.
More of a Lisa thing. I don't have anything to add, but you know, we are excited.
Right.
We are excited.
Yep. So we'll be talking about that more. Also, Christina alluded to the homeless coalition first meeting at the hospital that some of y'all may have been there. And if you were, you would have received a survey today to give some feedback. It was, I think, done very extraordinarily well to start having good conversations that help people to have better understanding and then move toward how is our community addressing homelessness as a whole, which the work that some of us do, Family Promise with day services, is just a piece of that. So there's lots of parts that we will see being addressed through that process. So also excited about that opportunity moving forward as well. And that was United Way and Chamber of Commerce who have begun that process. So we appreciate that and look forward to getting kind of an update here as well. Okay. And Melissa, I was going to check with you.
Yeah, I do have a couple of things. As you all might know, we have seen an increase in fentanyl in our region. We've had incidences at both Tennessee and Virginia side schools with overdoses, and we've had at least one death from fentanyl. We're also seeing an increase in vaping. G, you were talking about that earlier at our elementary schools. So Bristol, Virginia Public Schools did a fentanyl awareness day prior to the end of the school year, and they're planning on doing multiple different events throughout the year. Bristol, Tennessee City Schools is in the process of planning for an awareness day event and multiple events throughout the school year next year. So if you're interested in keeping up with that, if you're interested in hearing what comes out of that, then feel free to shoot me an email and we'll put you on our mailing list. In addition, Bristol has had 2 Juneteenth celebrations so far, and the ladies who put that together, the Future Black Leaders Coalition, do not have the capacity to do it this year. We found out kind of late in the game. So Bristol's Promise said, you know what, we will come alongside and we will help plan this. It is scheduled for June 18th from 4 p.m. to 8 p.m. at Cumberland Square Park. And I'll be reaching out to folks probably next week to see about if you want to set up a table. We'd love to have health departments there to do blood pressure screenings, or if you want to get information out. It is a day of celebration, but we also want to be able to share information with our community. So, and I think that's all I have, Margaret.
Okay, well, I will add that we have 2 trauma-informed care coalition work, and one's for Northeast Tennessee and the other Southwest Virginia. And the Southwest Virginia is Thursday, June 16th. It's in person at the higher ed from 12 to 3. And Melissa, what ours is later in June. For the Northeast Tennessee that Bristol's Promise coordinates. There's a lot of things on Bristol's Promise's calendar. Also, if you, Melissa put her contact information, but it's melissa@bristolspromise.org to get in touch with her. And you can always respond to me from the emails that you get for anything else. Also, I'll just say the Strong ACC, many of y'all are part of that. And certainly if you're not, you want to look at doing that for trying to bring us all together as a region. And there's 2 things. There's Strong Kids on June 7th in person at Bristol Motor Speedway for the state of the child. And I think Melissa's one of the speakers there. So encourage y'all to come and see what kind of discussions we have there. And then there's an all-member Strong ACC, and ACC is Accountable Care Community on Wednesday, June 8th, and it's virtual. So if you don't receive emails for those things and want to, again, reach out to us. We're happy to share that with you. The other thing I was just going to say that please give feedback about the effectiveness of these meetings, how we can do it better, whether you do feel like you benefit from these. We've been doing them a long time. We also have Bristol Coalitions and this meeting. So it's whether we have opportunities to combine, or does it work better? Bristol Coalitions tends to be a little more Virginia focused. We tend to be a little more Tennessee, but both do, I think, do a good job of including both. So I think you can learn from attending both of them, each of them. But so any good feedback, especially as we're moving forward, and we should hopefully have somebody who will be helping facilitate some of our working together, thinking about future pandemics and other work that we do. So please give feedback, send it to me, send it to Melissa, anywhere would be helpful just to hear from you. So, okay, if there's nothing else, then we appreciate your being here. This is a holiday weekend, so I appreciate that y'all are probably working the full day and then be able to move on from there. So I appreciate everybody. Thank you so much for sharing. I know I learned a lot today from several different things that I was not aware of or learned about. So appreciate y'all very much, and we will send out recording and chat later on. So thank you.